रूपानी फाउंडेशन 2007 से ह्यूस्टन, अमेरिका में काम करने वाली एक गैर मुनाफा बख्श तंजीम है। ये बच्चों की बुनियादी देखभाल और माओं की जहनी और जिस्मानी सेहत के लिए काम करती है। इदारे का मकसद ये है कि बच्चे की परवरिश अव्वलीन तरजीह हो, जिसके लिए वालिदैन उस्ताद का किरदार अदा करें, ख़ानदान और मोहल्ला मिलकर बेहतरीन माहौल बनाएं।
All gathered here today to really understand I would say the need during your pregnancy. What are your needs? What are your requirements? What are your challenges? What are your issues? How can you address the pregnancy period?
रूपानी फाउंडेशन बच्चों, वालिदैन और पूरी कम्युनिटी की मदद करती है और माओं की जहनी सेहत और ख़ानदानों की माली मुआवनत पर भी काम करती है।
Hi, my name is Kevin Barker and I'm with Behavioral Health Services of Fort Bend County. And we are so blessed to be able to participate in this great event through the Rupani Foundation, being able to provide information about prenatal care, the importance of mental health, as well as nutrition and just wellness checkups for women that are starting their life as new mothers.
रूपानी फाउंडेशन ने जुमा 15 मई 2026 को हामला ख़वातीन और माओं की मदद के लिए एक मुफ्त प्रोग्राम का इनेकाद किया, जिसका मकसद इन माओं और हामला ख़वातीन की जहनी, जिस्मानी और नफ्सियाती सेहत और बच्चे की निगरानी और परवरिश के बारे में मालूमात देना था।
I understand we're talking about pregnancy and postpartum, and this topic is very close to my heart. I have a 7-year-old and I just had a baby 11 months old. So I feel like this is really important to me because I feel like what knowledge I have and the population that I've worked with, I want to help and do my best to give you some information that you can take home today.
इस एक रोज़ा प्रोग्राम के ज़रिए हामला ख़वातीन और माओं को ये बताया गया कि सेहतमंद हमल, सेहतमंद वालिदैन और बच्चे के ताल्लुकात एक महफूज माशरे की बुनियाद हैं।
Every pregnancy experience is unique, so please do not compare each other's pregnancy because everybody is different.
इस मौके पर रूपानी फाउंडेशन के चेयरमैन नसरुद्दीन रूपानी ने मीडिया से खुसूसी गुफ्तगू करते हुए बताया,
Serving for about 20 years and basically we promote early childhood development program. I would say the terminology for early childhood is usually used 0 to 3, and we have been serving as from 0 to 3. But now, as things are progressing, we are really promoting -1 to 3 because -1 is really preconceiving or conceiving period. Because when somebody says 0 to 3, and you ask them, where does 0 start? Is it delivery and by child is in hand or child is in my mother's womb? So we have really been promoting -1 to clarify that maternal period I think is very, very critical, and this is what we believe in and this is what we are promoting here today. That's why we call it prenatal conference. The prenatal means they come here while they are pregnant. So we, I would say, educate these mothers of all the challenges, issues, and provide them all the resources they need during and after delivery. Because I have 3 daughters. I've seen basically their, I would say, during their prenatal period, and I've seen them delivering, and after delivery I've never seen and never seen with my life, but my wife, but I've seen with my children that this is so difficult period for those few weeks when a mother delivers a child. Mothers are, sleep deprived. They have no life while they're delivering the child, while they are nursing the child, and basically these mothers are suffering because they don't have the knowledge or educated before delivering the child. That should be a proper briefing must be given to each mother that this is not an easy period, because, and this is what is happening right now, is that what I am getting numbers is about 45% of our mothers are going through postpartum depression, and most of them don't even know what postpartum depressions are. And they are suffering, and because of the mother's suffering, there is a child suffering, because automatically mothers can't support the child when the mother is suffering. and is a direct impact on our children's mental health. And this is what I believe is that our children, when they are going through an early anxiety, and mothers are not, I would say, giving them the comfort and security that they need. Child needs security, safety, and basically skin touch of the mother, and they should be holding the child throughout the day and giving them, nursing them. And I think the full understanding of that what responsibilities and what mothers should be delivering to the child is lacking and is missing here. And we are trying to promote that this is not an easy job, it's a very serious job. It's a commitment, it's a lifetime commitment. It's not that you're going to say after 18, bye-bye, now you're on your own. It doesn't work that way. It's just basically, once you deliver a child is, and for your entire life, a responsibility. And it just, especially the prenatal period that we are trying to really address is that right now, about 75% of mothers are working mothers. And if they're 75% of the working mothers, during that prenatal period, they go to so much anxiety and stress and suffering that is directly impacting the child in the womb, because child is getting all impact of mother's brain thinking. So mother is basically really anything she does during the I would say pregnancy period, whatever she sees, whatever she eats, thinks, hears, everything that mother does impacts the child's development.
इसी मौके पर रूपानी फाउंडेशन के सीईओ अजीजुल्लाह बेग से बात करते हुए उन्होंने हमें बताया,
आज ये इवेंट हम अरेंज कर रहे हैं जो हामला ख़वातीन हैं उनके लिए। हम इस सीरीज़ में काफ़ी सारे इवेंट्स पहले भी कर चुके हैं। ये इवेंट इस इवेंट का मकसद जो है ख़वातीन को उनके हमल के दौरान में जो तकलीफ़ात होती हैं उससे पहले उनको अवेयरनेस देना है। उसमें हम टेक्निकल एक्सपर्ट्स को, जिसमें गायनेकोलॉजिस्ट, मेंटल हेल्थ एक्सपर्ट्स और साथ साथ न्यूट्रिशन के एक्सपर्ट्स को हम बुलाते हैं ताकि वो इन ख़वातीन के साथ मिल के बैठें और उनको इनकी इस प्रोसेस के अंदर इनको हेल्प कर सकें।
इस एक रोज़ा प्रोग्राम को 2 ज़बानों यानी स्पेनिश और दरी में मालूमात, आगही और रहनुमाई की फराहमी के लिए इस्तेमाल किया गया। इस तकरीब का इनेकाद यूनाइटेड वे ऑफ ग्रेटर ह्यूस्टन के इश्तराक से किया गया।
और आज इधर हम रूपानी फाउंडेशन इवेंट पर आए हैं जिनका इनिशिएटिव है प्रेग्नेंट वुमेन और ड्यूरिंग प्रेगनेंसी उनको कितने इश्यूज होते हैं और वो फिर अफेक्ट करता है बच्चों की हेल्थ पे। तो प्लीज़ ज्वाइन करें, ये प्रोग्राम इतना हेल्पफुल है स्पेसिफिक प्रेगनेंसी, पोस्टपार्टम एंड अर्लियर चाइल्डहुड। और उसी टाइम में हम लोगों को बेसिकली माओं को बहुत हेल्प चाहिए होती है।
इस प्रोग्राम में शुरका को मुफ्त वेलकम, हैप्पी बैग, डायपर, बच्चों की ज़रूरी चीज़ें और डॉक्टरों और दिमागी सेहत की खिदमात और चाइल्ड केयर के ज़ाती हवाले दिए गए।
So I think it's absolutely wonderful that we have the opportunity to pass along very important information about maternal well-being to women who may not ordinarily have access to that information, because when we educate ourselves as a community and different communities, then we're able to increase our wellness, increase our productivity, increase our just well-being altogether. So I'm so excited to be a part of this. I'm so excited to answer questions, to reach out and connect with other members of the community and other professionals who are out here doing this work. And I just want to thank the Rupani Foundation for including me.
ये तमाम बातें स्पेनिश और दरी ज़बानों में थी और इस मौके पर तर्जुमे की सहूलत भी मौजूद थी।
Por más de 15 años y también soy la gerente de una institución que provee terapia física. Estoy contenta de estar aquí con ustedes.
سلام به همه، امید که همگی خوب باشین، خوش باشین و صحت تیار باشین در خانه خود و در هر جایی که هستین.